Dementia. Dementia causes damage in the brain cells. The result is poor memory and difficulty learning. The symptoms are aphasia, loss of speaking ability, agnosia, not recognizing a family's face, and apraxia, not performing the normal movement, such as copying the draw. Dementia category. Alzheimer's disease is the most common, 70% of dementia. There's Lewy body dementia, vascular disease dementia, younger onset, and dementia caused by alcohol, HIV, or Parkinson's disease. The progression is as follows. First one is early stage, and dementia is not detectable. Then it goes to short-term memory loss. For example, did I have breakfast? And their language skill is declining. Some movement skill is lost. There's long-term memory loss. For example, what is my wife's name? And there's later phase and disorientation. So the patient go outside and they cannot find the way back to home. The last stage. So the patient is staying in bed all day long, and the death comes due to other infections such as pneumonia or etc. So the dementia categories. The Lewy body dementia composes of dementia with Lewy body, DLB, and Parkinson's disease dementia, PTD. So here brain neurons are dying. Patients have difficulty in concentration, attention, confusion, and difficulty judging distances. There's dementia caused by vascular diseases. There's a problem with blood circulation in the brain. A common one is multi-infarct dementia. It means multiple areas in the brain are injured due to lack of blood from a lot of small strokes. The result is hard learning, memory loss, and damaged language skills. Younger onset dementia is for people who are under 65 years old. Mental functioning is declining. There's memory loss, social skill loss, and normal emotional reaction is declining. There's a frontotemporal dementia, and it's called FTD. Sometimes the behavioral comes in front of the FTD. So for example, the grandma used to be very polite and nice, but suddenly after she has FTD, she becomes very irritated and angry. So the behavior changes. When the frontal lobe is affected, it changes in personality and behavior. And when the temporal lobe is affected, there are a lot of language skill loss. Alzheimer's disease is the most common one in dementia, which takes 70% of all dementia classes. It includes memory loss. So there's MMSE test, which detects the severity of Alzheimer's disease. MMSE test includes questions like, what year are we in now? Please spell pharmacy in the opposite way. What month is today? It comes to 1% for people who are 60 to 65 years old, but the risk is 50% for people who are more than 85 years old. So as the ages increase, the more the Alzheimer's disease rate is. The reason for the Alzheimer's disease is that there's neural loss in the brain cortex. There's protein called amyloid precursor protein, which helps grow and repair neuron. So it is okay when this amyloid precursor protein is chopped down by alpha or gamma secretases. It is fine. But when it is chopped down by beta secretase, it causes a problem because segment is not soluble. This forms beta amyloid plaque between neurons and inhibit neuron signaling, resulting in memory loss. So beta amyloid plaque can cause inflammation around neurons and forms of amyloid angiopathy, causing blood vessel rupture in brain. It causes impairing in brain functions. And the other reason is that there's a tau protein. Tau is railway protein that makes roads in neurons. However, with Alzheimer's disease, These proteins are tangled and form the gathering and damages the neurons. So let's talk about the drugs for Alzheimer's disease. We have Donepezil, Galantamine, and Rivastigmine. They are all acetylcholinesterase inhibitors. In other words, anti-acetylcholinesterase. It slowly improves the patient's awareness, cognition, alertness, and function. They also reduce hallucination frequencies, and all three have similar efficacy. Side effect is nausea, dyspepsia, which is not absorbing food well in GI tract, stomach pain, or bradycardia. So the patients who have history of peptic ulcer disease or bradyarrhythmias should be aware when they are taking the acetylcholinesterase inhibitor. So anti-acetylcholinesterase, the beneficial effect will be observed within 3 to 6 months. Donepezil, galantamine, rivastigmine can improve cognition and symptoms, but it is not the total cure solution because there's no decreased risk of developing Alzheimer's disease. And please beware, there's cascade happens if these are used with acetylcholinergic, for example, TCA, amitriptyline. So don't use these at the same time because acetylcholinergics can cause cognitive impairment and worsen symptoms. It causes cascade. Also, commence this anti-acetylcholinesterase with a small dose, then increase gradually to reduce the side effects. They should be given with food because it can cause stomach upset, and Alzheimer's disease is more serious than just mild cognitive impairment. So, for the mild to moderate Alzheimer, Donepezil at night 5 mg for 4 weeks, then increase it to 10 mg, which is gradually increasing. However, if the vivid dream, which is side effect, comes, then at that time you can change it into the morning. Galantamine modified release. In the morning, 8 mg for 4 weeks, then 60 mg for 4 weeks, and 24 mg for 4 weeks. Rivastigmine for 4 weeks, then increase for 4 weeks. If the Alzheimer is severe, then you can add Memantine. The Memantine should also be slowly titrated up, just like other medicines. Memantine is NMDA, NAMDA receptor antagonist. Let's talk about non-pharma management. So, for the dementia patient, the room environment can be harsh. So for them to live a better life, the level of light should be high, and it is good to put the clock in. So there's the sign that tells differently can be good, and the floor should be non-reflective because it can confuse the dementia patients. No pattern is better. Simple color floor is better. And put a name on the toothbrush. Put picture that stimulate their memory. For example, family photo. And remove the obstructive furnitures that can be overwhelming. Remove the puzzles. And when there's a chair, like the chair with a back is better for them. Also, the exercise and doing some recreation activities can stimulate the cognition ability in the dementia patient. Prove patient's driving ability at diagnosis and report if necessary. Provide information about hospital in community. Regularly take exams such as MMSE. Also, vitamins or other minerals. They don't help Alzheimer's disease, so keep this in mind.